not everybody who ages develop dementia.
Okay.
So while memory decline or some amount of forgetfulness is something that we can expect in everybody who ages. See, there are two sets of risks for dementia and Alzheimer's.
Okay.
One set is the genetic risk, the second set is the environmental risk. So whatever you keeps your heart healthy, keeps your brain healthy.
Welcome to another episode of Age of Grace, a podcast where we will talk everything that matters to the elderly. I'm your host, Kumaran, and this series is brought to you by Happiest Health. Dementia and Alzheimer's are conditions that affect millions of seniors worldwide, bringing emotional and practical challenges for both patients and caregivers. Today, we discuss specialized care approaches and innovations in the treatment which can make a difference. And to guide us through this, we have Dr. Naren P. Rao. We welcome you, Doctor.
Thank you.
Dr. Naren P. Rao was former professor of psychiatry at NIMHANS and assistant professor at the Indian Institute of Sciences, Bangalore. He completed his MD at NIMHANS and a PDF at the Center for Addiction and Mental Health, University of Toronto, Canada. With over 160 publications in international scientific journals, he's received many awards, to name a few: International Young Investigator Award, Canada Hope Fellowship, Young Investigator, Aristotle's Research Award, and the Innovative Young Biotechnologist Award. We welcome you, Doctor.
Thank you.
Doctor, to begin with this discussion on dementia and Alzheimer's, one of the first questions that comes to our mind is, do everyone are at the risk of developing dementia and Alzheimer's when they age?
Yeah, so it's an excellent question, because this is something that everybody is worried, that will I develop dementia as I age?
Yeah.
So not everybody who ages develop dementia.
Okay.
So while memory decline or some amount of forgetfulness is something that we can expect in everybody who ages,
Okay.
not everybody would develop dementia.
Okay.
So there is something called as a normal aging, in which the cognitive abilities decrease. But dementia is a pathological condition. So dementia is an illness where the normal memory loss, what you see in every individual, is maybe 10 times more. So to put it in a brief, not everybody develops dementia. So there are few individuals who develop dementia as they age.
Okay. Doctor, so if that is the case, how can one prevent to the risk of dementia or Alzheimer's?
Yeah. See, there are two sets of risks for dementia and Alzheimer's.
Okay.
One set is the genetic risk, the second set is the environmental risk. So while we cannot change the genes, there is a good scope to change the environmental factors. So these are the modifiable factors.
Okay.
So one thing that is shown to be helpful in preventing the dementia is taking care of your vascular health. That is, whatever you keeps your heart healthy, keeps your brain healthy. So the risk for dementia increases considerably if somebody has poor blood supply to the brain. So taking care of your diabetes, taking care of your hypertension, taking care of your cholesterol from the middle age is important, because elderly tend to take care of their hypertension, cholesterol, all those when they become 60, 65, but the damage is already done. So it is very important that they start having an active lifestyle when they are in their 40s and 50s, and then when they are elderly, it is very important that they take care of their physical health very seriously. The second set of things which helps to protect is having a very social engagement in their lives, and having a good psychological stimulation. So we suggest people to learn a second language if they haven't done when they become a little elderly, because more and more stimulation actually is something that is protective, keeps brain active. Yeah. Lack of social interactions is a risk factor. So it's something that is advisable to all elderly, that don't leave out your friend circle, don't leave out your neighborhoods, don't leave interacting with others. If not in person, start virtually. As and when possible, you go to the nearby functions that are happening. If there is a temple, visit that. If there is a religious place that you want to visit, you visit that. Interact with others of your own. Go to park every day. So social interactions, psychological stimulation, that is cognitive stimulation, and taking care of the physical health. These are the things that every individual should do to prevent. Yeah.
So when we're talking about this, doctor, so of course the fear of getting dementia when we age. Are there treatments available for dementia and Alzheimer's?
Yeah. So, dementia, when it comes to development of dementia, it progresses from normal aging to a stage what we call as a mild cognitive impairment, and then it progresses to dementia. So, if we detect individuals at the stage of mild cognitive impairment, which is like there is development of cognitive deficits, that is memory issues or arithmetic abilities or changes in their ability to function, but not to the extent of completely losing them. So, in this stage of mild cognitive impairment, if we are able to detect and then start the medications, it is shown to delay the development of dementia, and in many instances it may also protect them from further worsening. If somebody has already developed dementia, then reversing the course is not possible at this stage with the medications. So, the treatment at that stage is going to be focused more towards improving their quality of life, decreasing the distress, and how to preserve the cognitive functions that are still working well. So that's the current status of the treatment in dementia.
Okay. Doctor, so apart from the treatment aspect of it, are there any other modalities to treat dementia and Alzheimer's?
Yeah, apart from the medications, there are treatments in the form of, one is the supportive therapy, so that the individuals who are in the developmental phase of dementia, so how do we counsel them, how do we give support to them so that they don't get depressed, they don't develop hopelessness. There is also something called as cognitive retraining, in which it is more like a mental gym. So same like you go to the gym to build your muscles. So in cognitive retraining, we make individuals to do certain cognitive activities to improve and preserve their mental abilities without the medication. So cognitive retraining, social interactions, and supportive therapy, these are definitely some of the things that are available. And if they are in a place where they could go and meet other individuals of their own age, so that is the daycare facility or the residential care facilities, where they could have more and more social interactions. That is also something that will be helpful to those individuals.
One last thing I have heard about dementia and Alzheimer's, other modalities, is that music therapy helps people. Is it, how far does it?
Yeah. Say, there are two aspects in dementia. One is reversing the cognitive decline. The second thing is how do we improve their mental well-being, and how do we preserve the functions that are already preserved, already working well. Yeah. So many other modalities like the music therapy, physical activities in the form of aerobic exercises, yoga, these are all the things that are shown to be helpful both to improve their psychological functioning and also their quality of life. And once these things are better, it helps to prevent further deterioration in their cognitive abilities.
Great. Thank you so much, Doctor, for sharing these valuable insights on dementia and Alzheimer's.
Sure. Thank you.
Dementia and Alzheimer's require a compassionate and informed approach, not just for patients but for their caregivers as well. Thank you, Dr. Rao, for sharing a lot of information on Alzheimer's and dementia. To our listeners, stay informed, stay prepared, and join us next time for another insightful discussion on Age of Grace. Take care.